Chris Robinson. I am the manager of urgent care for those of you who don't know me.
I'm Dr. Katie Anderson, one of the urgent care physicians.
All right, and let's take a tour of our lobby here that we just recently finished. You can see our DSs now have much more presence in the lobby rather than behind a wall. And over here we have the charge nurse desk. This is where the charge nurse sits. They manage the flow of the department. They assign patients to providers. They keep an ear open when they hear keywords from people checking in that need to be brought back sooner rather than later. They jump on that and take care of all of that. So this is door 49. This was added during COVID, so we had a private entrance for urgent care. Comes in very handy. On weekends, it is the only door that is open to the clinic. We now have the front door, door 50, is locked after hours and on the weekends. So.
This is our triage room where the nurses will, patients that are having more acute symptoms or concerning symptoms, they'll take them in here right away and triage them so that they can be seen quickly if they need to be. So we have some traditional exam rooms here still.
Yes.
Yeah, new floor and countertops, paint. And then here we have the new nurses station. So it's very open. It enables nurses to be able to see most of the exam rooms, so they have better access to patients, and the providers can stand here and chart and talk to their nurse, so there's better communication. Lots more space.
Over here is our medication prep area. Our med fridge, medications up above.
This space.
The benefits of this space is we have, as you can see, patient rooms directly across from the nurse's station. We have 6 cardiac rooms directly across. Can keep an eye on patients that we're concerned about, someone who may be having chest pain, or an elderly patient that maybe we think might need some help. We can keep a close eye on them. The other thing about this workstation that's really nice is you can sit here with your provider. The provider's not looking for a nurse, like, where's my nurse? They're sitting together, very easy communication.
So this is one of our new exam rooms. So it has this nice glass sliding door, a lot wider, so we can fit stretchers and wheelchairs through there much more easily. So in the room we have, in these large rooms, we have 6 of them. There's stretchers in every room. We do have cardiac monitoring now, so we can continuously monitor people's heart rhythm, their oxygen. So these are more for patients that are going to be here for an hour or two. We also have nice overhead lights for any procedures that we do. There's more space in the exam rooms, again, for wheelchairs and family members and that kind of thing. These rooms are nice for patients getting IV fluids because they can, they're going to be here an hour or two, they can lay down. If someone's having chest pain or short of breath or a little more acute symptoms, we can put them on the monitor, and the nurses have the screens out at the nurses station, so they don't even need to be in the room and they can see what the heart rhythm's doing. The monitor will alarm if there's anything abnormal.
So this is our central station for our cardiac monitors. So let's say you have a patient with chest pain and we need to put them on a cardiac monitor. That shows up out here at the desk. We have specific alarm limits on it. So if I'm sitting here and something should happen with the patient's heart rhythm, rate, blood pressure, respiratory rate, it will alarm out here so that we may go in and check on the patient immediately.
Yes, we do accept patients from EMS now. Ones that don't quite need to be in the emergency department, but patients that called the ambulance because they couldn't get up or have a horrible headache or things that we can manage here. They'll call us first and we accept the patient, and so they'll bring the patient right here rather than going to the emergency department and tying up their staff and waiting room with patients that don't need to be there.
So this is where the results nurses sit. But there's 2 nurses who sit here that handle all the COVID, flu, strep, cultures. They handle all of that stuff. They call patients, they triage patients over the phone, they do all the monoclonal antibody referrals. They have a lot on their plate. It's too numerous to mention all the things they do. No, so we still have CT, X-ray, ultrasound, all of the lab, any lab tests for the whole time, the entire time we're open. And we can sometimes get next day MRI. I don't think that our urgent care has changed, and I think we're seeing patients more safely than we were previously. But your typical urgent care does not do IV infusions nor IV medications. They don't take chest pain, abdominal pain, and with our cardiac monitors, it gives us that capability to work those patients up and keep them out of the emergency department.
It saves the patient's money, it prevents, the ER has long wait times, so it's better for patient satisfaction. And
we do get some patients here that are not appropriate. They need a higher level of care, but we will assess them, stabilize them, and then get them from here to the OR. So, order all the labs.
So here in our department, we have a lab upstairs here now in urgent care, which is nice. It makes things more efficient. So the phlebotomist will go right to the patient's room and draw their blood here, so we don't have to send patients downstairs. They run all the COVID tests and strep tests up here too. And then any other blood samples or other swabs or urines get tubed downstairs to lab. We have at least 1 lab person working up here at all times, which has made things a lot more efficient. I love the nurse station. It's nice and open, so I think communication will be better between providers and nurses.
And I think having everybody all in one space, it's easier to find the person you're looking for instead of like, are they down this hallway? Are they sitting in that space?